Okay, thank you, Nikki.
This is Emily with SESDAC. Our staff started to get vaccinated the last week of December. And we're working with Sanford here in Vermilion, and I know that they do plan to vaccinate people supported. We just don't know a specific date yet.
Okay, anybody else? Well, Julie, Joey, there you guys go. That's kind of a little status update of what we're seeing there. It does sound though like, it's starting to move with getting people supported vaccinated. I hope this is helpful for you guys to kind of get an idea of what's going on. And do you guys have any information on that new CDC guideline change?
I do not, but I would ask Jana if she has any new updates on that at this point.
I don't have any updates on that, Dan. I know there was meetings yesterday with DOH and no updates yet.
Okay. Well, and it sounds like it's pretty new, so I'm sure you'll hear about it.
Yep. Yeah, I will say that officially Group D starts on Monday, this coming Monday. So just so you know that, and that's what the Department of Health has let us know. So that starts on Monday officially.
Okay.
Dan, did you have other questions that you wanted to bring forward today?
Did we have anything else, you guys?
I have one question.
Oh, go ahead, Nathan.
There's an article in Sioux Falls Business by Jody Schwan where she interviewed Kim Wilson-Risden, saying that 80 years and older will start. I mean, there's an announcement in the public, but we don't know about it. Just a question. What her source was.
I haven't received any updates about it, and I did talk to a member of the vaccination team this morning, and she didn't have any updates for me as of yet. So that's all I can tell you. I have not been updated. But I mean, the health systems are coming up with the plans in your community to get people vaccinated. And I can tell you, like I said, Group 1D, your participants start Monday officially. For the people that have already got their vaccinations, that's great. But technically we're not even in phase 1D yet. So
I had a question. Can you hear me?
I can.
Okay. And I don't know, this might be for Department of Health. I'm not sure if there's anybody from Department of Health on here, but so Live Center, like many other CSPs, is also considered a school district through the Department of Ed because we get our license plates through them. And so I got a letter from Marie Brady with the Department of Health saying because we're a school district that she needs to be my point of contact for any positives that we have with staff or people supported. And so I explained that I already report to the Division of DD, and she said that we still had to report through her. And so, we have to report to our program specialists. We deal with Jana for sentinel testing. We deal with Leah when we have positives. It just seems like that's overkill. And I don't know if there's anything we can do to eliminate that other, since we're already working with the Department of Health, to just eliminate that person. And I don't know where to, start with that.
Is that specifically for people receiving like educational services, or what is the specific requirement that she's?
Her letter says, my name is Marie Brady. I work with the South Dakota Department of Health. Moving forward, I am going to be your point of contact for the Live Center School District. I will be this person sending and receiving the Excel workbooks. I will send you the requests on positive cases in your school district. If you learn of a positive person before I do, you can also send me the completed workbooks preemptively. And so none of the other CSPs seem to get that same letter. And we don't even have any school age kids or anything like that. We just do it for the license plates. So it seems like just one more hoop to jump through in this whole COVID craziness.
So did you visit with her and just kind of clarify that and let her know that you don't have anybody receiving educational services, or?
Well, I just said I already report to the Division of DD, and she said I still have to report to her as a school district. And so I'm like, well, we are a school district as per the state, but I'm just wondering, I guess, why we're the only one, or why if we can't, Leah's already our point of contact. I don't know I didn't know until today that no other CSPs had gotten that letter too. And so I'm just wondering if it was just an oversight. I don't really know. I guess I can keep asking her, but she kind of trumps me in this situation. So I didn't know if I needed to discuss it with you guys also.
Okay. Yeah, I can definitely send an email to somebody at the Department of Health and just kind of clarify that. I've never heard of that, or haven't heard of that. So yeah, I guess I don't know the answer to your question. And I wouldn't think that if if you don't have anybody receiving those services, I wouldn't think that you would have to report anything to them, would be my thoughts, but I would definitely clarify that for you.
Okay, I'll forward you the email she sent me, Jana.
Sounds good.
Joey, I think that was probably it for our questions that we had, unless somebody online has an additional question. Anybody? Okay. Do you guys have any updates for us?
I do not have any additional updates. I would ask Jana, do you feel like we've spoken about any updates, or do you have additional things that we should be aware of?
I don't have really much for additional things. I'll send out the COVID hotline and email address for any additional questions that you guys might have. I think they want the questions going to that email and that number so they can kind of gather them and group them and put out fact documents and things like that. So I will send that out. And then there's additional infographics coming out. So I'll send those as I receive those. But other than that, I really don't have much for any updates. And then just for that Huron specific question, that Huron Regional Medical Center is the county vaccination resource for that community. So that is on the Department of Health website. So I'm not sure why they are saying that they're not your healthcare agency, because they are identified as that. But I can certainly send that to the Department of Health as well, or if you guys want to do that directly, you can do that too.
Yeah, I think it probably would be helpful. I don't know, I guess, at what level the Department of Health is actually contacting individual healthcare providers on this, but I think Kristen would agree, if there is any way that the Department of Health could reach out to them to clarify that, I think it'd be very helpful.
Yeah, I think the Department of Health is very busy with the rollout, and there's so many people in these groups, and so they're just trying to get all the questions to one source, just to get out those fact documents and just see where the issues are lying, and so that's kind of where they're at, I think, and like I said, phase D just rolls out next week, so we're technically not even in that phase. So so I think we're doing fairly well for where we're at.
Excellent. Thank you, Jen. We'll probably kind of stick with this status update, I think, on these calls just to keep you guys informed. So, the next one, we'll probably have a way better idea of what's going on since Phase D starts on Monday. So our next call would be two weeks from now. Is that right? Okay. Is there any other questions that association members might have? All right, I guess we're done on our end, Joey. So if you have anything else.
I would just say thank you. We appreciate you taking the time to give us an update on what's going on as far as vaccinations for both staff and people supported. It's very helpful. Thank you.
You bet. Thank you.
Thank you. Have a good day.
All right. Yep.
Bye.
Thanks, guys. Bye.